All right, welcome to another episode of the Black Surgeons podcast. We have Dr. Cole today, who is actually one of my mentors, I would say, from back in the day. I'm super excited to have him here today to just talk about his journey. He is currently just started his attending job here in ATL. He's an orthopedic surgeon. I'm not going to take too much time introducing him, but Dr. Wendell, thank you so much for being here. To just getting started, do you mind letting us know who you are, what you do, just in a couple minutes?
Yeah, and first off, congrats to you, Ben. This is from somebody that has started a podcast and has been out interviewing people. I know it's not an easy thing to do, so big shout out to you and what you've been able to accomplish and what you're working on right now. So I tip my hats off to you. And for those of you that are listening, it's like Ben said, my name is Wendell Cole. I am a newer orthopedic sports surgeon here in the Atlanta or the Metro Atlanta area, and yeah, so I did my med school at Morehouse School of Medicine. I did my training over at Tulane in New Orleans. I did a year of orthopedic surgery, sports specific fellowship up in New York at NYU, and then I'm back home in Atlanta. So thanks so much for having me on your podcast.
Nice, man. So to just get started, can you tell us a little bit of where you grew up and how all this kind of got started? A little bit about your parents, a little bit, maybe up to middle school, high school time.
Yeah, no. So both my parents are actually immigrants from the Caribbean. So my dad is from an island called Jamaica, which most people know, and then my mom is from a smaller island, which most people don't know, but it's called Grenada. And so I was actually born up in New York, and I was raised there for a little while, and then I moved around a bunch and ended up here in Georgia. Grew up with my mom for the most part, but also I have a lot of brothers and sisters. Whatever number you think, probably triple that amount, right? I grew up I have about 15 brothers and sisters, or at least I did growing up. Now I have a couple more, but
Wow.
big family, right? But me and my mom basically grew up. I moved around with her for the most part, and so as a kid, I was interested in a lot of things. I was kind of the guy that played a lot of sports growing up. Like I did some taekwondo, I did soccer, I played some basketball. And I never said I was good at all these things, but I played them. But I also was a kid that was like looking in the microscope, right, when I was a kid. What's interesting is I remember maybe a couple months ago, my mom was showing me a journal that I had, right? I had a little journal when I was in fourth grade. One of those things that you can buy that have prompts that say, when I grow up, I want to be this, and these are my best friends now. One of those kid kind of journals. And I was looking at it because that's fourth grade. I was over what 20, like a long time ago, basically. And so I was looking at it, and it said, when I grow up, I want to be a doctor. And I was like, there's no way I was thinking that at this age. But I mean, I guess you could say that I always wanted to be one, but I always kept my mind open to other things as well. So I grew up with my mom, and she did a lot, right? Like just growing up watching her, she worked, very hard to take care of me. She was an entrepreneur in some sorts, right? She started her own businesses. So from young, it was kind of put in my head that there are no limits, right? You can kind of do what you want to do. Like you can anything that you put your mind to, you can do. And then her actually growing up in the Caribbean, they have a little bit of a different mindset. When they come to the States, just it's come to work and try to get as much done as you can. So I kind of grew up with that kind of a background. And then my dad was also always in my ear, the typical Caribbean Jamaican parent, go to school, engineer, lawyer, doctor. Those are the three, the only three fields that exist in the Caribbean household. So, I ended up having a long journey and ended up where I am now. But I grew up, that's kind of a little bit about how I grew up.
Nice, nice. So from high school, where did you go to college, and what major did you choose to pick, and why did you pick those majors? And I guess by then, did you know you wanted to be a doctor, or by this time you're like, I'm just gonna figure it out?
Well, it's interesting. My first year, well, I'll give you a story of applying to college, right? And
Mm.
so in high school, I remember it was my birthday and I got a letter from Harvard, and I was like, oh, this is just meant to be. Like, who gets a letter from Harvard inviting them to apply to their school on their birthday, right? So I applied there. I applied a couple other places. I forgot exactly how many places I applied to. And when it came back, I got denied from every single college. I think I got denied. I remember I think I applied to Tech, I applied to Emory, Harvard, and a couple other schools, and I got denied from every college. And then one day in the mail, I got a letter from a university called Mercer University, which is in South Georgia. It's in Macon, Georgia. Inviting me to apply. They would waive the application fee, and I was like, well, why not, right?
Mm-hmm.
So I actually did my first year of college down at Mercer in Macon, and then I ended up transferring to Georgia State, where I finished off my degree. And I initially actually started off with either chemistry or biology because I had in the back of my mind I wanted to do something in medicine, and I knew that you would be able to get those prerequisites classes if you hit those type of majors, your prerequisite classes you would have. So I
Mm-hmm.
ended up choosing a biology major. At first I was chemistry, and then I realized I hated AP chemistry, so I switched it to biology and went to Georgia State, got really involved in Georgia State. I wasn't the most out there person, but at Georgia State I try to put myself in uncomfortable situations, joined a fraternity, joined these different medical groups. We had a pre-med society, right? So I joined those
Mm-hmm.
societies and tried to get some early exposure to medicine and different doctors and things of that sort. Actually, at Georgia State, I took a class that was like an intro to anatomy class type thing, right? And we actually went with on one of the orthopedic surgeons, and we learned some things. With Dr. E was her name. If you're listening to
Mm-hmm.
this, Dr. E, shout out to you. So got some exposure during undergrad at Georgia State, and I mean it was a great couple years, a great facility, and that's what kind of made me choose that major. It's because I knew that it would cover those prerequisites, and I knew that's the route I was going to go. Right,
Yes.
you know,
Yeah.
just if you're not going to go those routes, those majors are a little bit harder to
Yeah.
justify.
Yeah. Absolutely. And so you're in college now. You're like, okay, I think med school might be for me. Now you're planning on applying to medical school. How broad did you apply? Where did you apply? And how did that go?
It's a good question. So I applied pretty broadly. I knew either I wanted to stay in Georgia or I wanted to go far away. One of the two. It wasn't an in between. It wasn't like I would go next door to Alabama or Tennessee. I was like, all right, I'm applying everywhere in Georgia, and then I'm applying to like California. Applied everywhere in California, I think.
Mm,
Luckily for me, when I went to school, I went to Georgia State University. That Morehouse Medical School was right down the street, and so what I would do is some days where I was free or I got out of class a little early, I would go over to Morehouse School of Medicine. I remember meeting some of the guys at the time there. One of the guys' name is Brandon Hunter, awesome guy at Morehouse School of Medicine. Now I told him, hey, I am a Georgia State University student. I'm interested in going to med school. I'm interested in going to med school here. And so I met some of the administrators there. And then I would go and sit in on the classes at Morehouse School of Medicine, right? So I'd sit in on like the first year classes. I'd be in the background. Nobody really knew who I was. I'm just sitting there like, all right, what are we talking about? Everything's going over my head, right? I have no idea what they're talking about. But I would go and sit in classes every now and then. And when it got time to apply, I applied everywhere in Georgia. So at that time, it was like Mercer, Medical College of Georgia, Morehouse School of Medicine, Emory. So I applied to all those different places, and I ended up getting in Morehouse School of Medicine. And I knew from that point, all the other interviews that I had, that I would end up choosing Morehouse School of Medicine from just the location wise and where my friend circle was, where my family was. So I ended up sticking with Morehouse School of Medicine. But one of the important things throughout that application is like having a mentor, right? I remember I had, and he's still one of my mentors to this day, Dr. Bob Lee. He was over at Emory. He was on the at the Emory school, and he was very involved there. And I just had somebody that I can bounce over ideas with, show him like, hey, this is my application, this is my statement. What do you truly think? And somebody that'll keep it real with you, right? Because he kept it real with me. He's like, hey, scoring this section on the MCAT's not that great. I'm gonna tell you right
mhm.
now. Like for typically what we accept, and I think it's a big part of whatever field you're trying to get into is having a good mentor, having somebody that you can reach out to and speak to, and somebody that's been there before, or at least somebody that's helped usher people that are going to that or that are going through that before. And so I wouldn't be here today if it wasn't through some of my mentors, but he was one of my mentors going through the jump from Georgia State University to med school.
Nice. I was definitely going to touch base about mentorship, but it's so important to have people who have
100%.
been there, who have at least have touched a few things that you're potentially going to see in the future. And I just can't emphasize enough about the power of having people who can support you through the journey or can vouch for you if you're applying somewhere. I know for me, having Dr. Moore, who's an ENT surgeon at Emory, he was super instrumental on why I ended up matching and why I chose the field. And so it's super important, if you're listening out there, just if you have a dream, find somebody who is in this space, and they should be able to kind of show you the ropes on how to get there. So
Yeah, it's like that saying where they say if you want to go fast, go by yourself, but if you want to go far, go with somebody else.
yeah,
Same thing.
yeah, I never thought about that as for mentorship, but
Yeah.
that is very key. Switching gears a little bit, you're at Morehouse School of Medicine, which is actually where I met you. You're a few years ahead of me. I remember since the day one I met you, I think you came and spoke to our M1 class, and you knew you wanted to do orthopedic surgery.
Yep.
Why orthopedic surgery?
Oh man, this is an interview question, man. Well, with orthopedic surgery, so I had my first exposure. I feel like I have the classic ortho story, right?
Mm,
I was when I was a kid, when I was playing in high school, I ended up tearing my meniscus and having surgery on my meniscus. And
mm,
then when I was in college, I was wrestling around with some friends, and I ended up tearing my ACL, right? And I guess the more impact it had with me is that I was never a person that was really social or like real emotional, right? I kind of
yeah.
let out my emotions through physical stuff, right? Through exercising and physical activity and things of that sort. And when I tore my ACL, I wasn't able to do those things. And so I kind of felt like a part of my self expression was lost in a sense, per se, right? And so when I ended up getting surgery on my knee, I remember I was at home looking it up on like YouTube, and I was seeing all these different surgeries of ACL reconstructions, and I was super interested, right? My mom would walk in and be like, dude, that's nasty. Why are you looking at that? And I'm like, nah, it's cool. It's what they're gonna do to
Mm.
my knee. So I was one of those guys. And going through the process, being the patient on that side of things and going through it and, going through rehab and getting it back and getting back to doing my activities. I remember I wanted to give that feeling to other people. So that's one of
Mm,
the things that drew me towards orthopedic surgery. Actually, going into med school, I was between orthopedics and emergency medicine. I was between those two. I thought emergency medicine was pretty cool too. I feel like they get to see a wide breadth of things. They have a pretty good lifestyle. You can burn out, but if you balance it, it's not terrible. It's a way that you
yeah.
can still live, and there's a lot of people that really enjoy their life. So that was part of it. And then going into the medical school at the beginning, I knew it was super competitive to get into orthopedic surgery. And I knew at Morehouse School of Medicine, there was no orthopedic surgery. So it's even more competitive. You have another hurdle to jump over, right? When you compare yourself to everybody at all the other schools who have, home ortho
Programs.
programs
Yeah.
that they can connect with from day one, right? Versus us, we're figuring it out on our way rotations.
Yeah.
So it was part of that. It was part of doing the program called Nth Dimensions, which we spoke about briefly before this started. And I actually was lucky enough to Nth Dimensions, for those that are listening, is a summer program for those that were interested in orthopedics. And now it's expanded to more than just orthopedic surgery. I think they do dermatology and a couple other fields. But I was able to get kind of stationed or paired with a doctor in Los Angeles, California, Colonel Job, Dr. Clarence Shields, another one of my key mentors through the time. And he exposed me to orthopedics, and it kind of exposed me to, kind of how the life is, and then how you can take care of patients. And, I was like, yeah, this is something that I can do. This is something that's for me.
Nice. Speaking of tearing, did you just recently have like a surgery or something? Did you
Yeah,
tear something
man.
again?
Oh man, this was rough. At the end of residency, right? I think that this is
Mm,
my no fourth year in residency. I don't even really even play basketball like that, right?
mhm,
I think I
yeah.
just went to the gym, and for a normal workout, I think I was starting to gain a little weight. So I'm like, all right, I'm gonna go to the gym, work out again. So I'm a couple weeks into it, And it's a nice day, it's hot outside, and I'm like, all right, let me just go. I'm just gonna go just shoot some hoops, just because I haven't shot a basketball in a while. So shoot some hoops, and I'm like, all right, I'm about to go inside and actually do the workout that I came to do. A couple of guys came up and were like, hey, you want to play some ball? And I was like, yeah, sure, why not? I haven't played in a while, but we might as well play a game. Playing the game goes fine, no problems. Last play of the game, somebody shoots the ball up, and then I go up to get a rebound. I take a step back, and I hear a loud pop. I thought somebody like kicked me in my heel, right? So I turned around, kind of getting ready, like, what's going on? Why would you do that? Nobody behind me,
It
empty.
sounds like a board question, huh?
Right? Looked down at my foot, it was flopping, and I was like, ah, man, tore my Achilles tendon.
Oh
So
my gosh.
tore the Achilles tendon, ended up getting an MRI and seeing one of my own tendons at Tulane, and ended up
Mm,
getting it fixed. So ended up getting my
yeah.
Achilles tendon fixed as an orthopedic surgery resident, and which is not fun, but it happens. So
Wow.
yeah, I ended up having surgery again. So I've had my fair share of orthopedic surgeries.
It just keeps following you.
I hope it's my last one. I hope to never need any orthopedic surgery again, ever again in life.
Hopefully, because now you're unattending, you probably have more time to do things. So we'll see.
Yeah. Yeah. You do. It's crazy, right? It starts off, you have in med school, you don't think you have time, but you still have time, right?
Yeah,
And
yeah,
then in residency, you have way less time. And
yeah,
then when you do fellowship, at least for us, you have a little bit more time. And then now as an attending, you have a little bit more time. So, it kind of goes, it's like a nice little pendulum.
yeah. Um, so tell me a little bit more, about your residency application. You went through nth dimensions. You're like, all right, ortho is for me. What steps did you take to help you become successful in your matching process? And
Again,
where did you end up eventually?
yeah, and so again, main thing, mentors, right? That here's another part that plays a role in it, right? I have my mentors that were helped me through undergrad to get into med school, and now I have my mentors that have helped me in med school to get into residency. So Dr. Bonnie Simpson Mason, she's the one that actually started Nth Dimension. So I spoke with her a lot. I spoke with Dr. Clarence Shields, who I actually did my rotation with a lot. And those two people really helped me out in figuring out where I would rotate, like who, the thought is like we need to go somewhere where we can at least connect you with somebody, right? Where
Mm,
there's at least one person that can at least give you a little inside scoop of what's going on, or like, who do you need to meet? Like who are the people that you should at least speak to? They can give you a little insight, like, yeah, no, we like you, you're doing great, or no, this attending is, you want to go somewhere where you'll at least have somebody that will have your back, whether it's a resident, whether it's an attending, whether it's somebody there on staff. So making those key connections, and then going and doing my away rotations, and then going and doing a good job on my away rotations. That's another big thing. So then I'd meet mentors. So then I'd meet mentors in that institution. Like when I was at NYU, Dr. Eric Strauss, I worked with him for 4 weeks. He's one of the orthopedic sports doctors. He ended up becoming one of my mentors too. And so I think what got me in is some strategic calculations and strategic connections, and maybe a little bit of luck too, right? Because where I ended up matching for residency, I matched at Tulane University. I actually didn't rotate there, so I just interviewed there, and I really liked the program, and luckily they really liked me, and so I matched there. I ended up there. It was a great training. Loved it a lot, and
hmm
so I think to wrap it up, the big things that helped me through med school, getting into residency, when we don't have an orthopedic surgery specialty at Morehouse School of Medicine, was making use of the people that I knew and leaning a lot on them, and then going places and then just trying to do a good job when you get there. Being nice to everybody is very important. So being nice to all the people there, the janitors, being nice to the scrub techs, being nice to the nurses, being a nice or a good person overall, so you have a good reputation, because that's important. Reputation can take you places, right? Even if it's at a place where you may not match, they may even call somebody else and say, hey, he didn't make it to our top, but we really liked him. I think he'll really do good. Like all these things can help you out.
Yeah.
So it's people, connections, and then going and doing a good job and working. I think that's one of the things that ended up letting me match into residency.
Nice, nice. To go into your career trajectory again, finishing up now, you end up picking sports. Why sports orthopedics?
Well, initially that was all I was exposed to. Right.
Mm,
So initially at Dimensions, I did it was a sports rotation for 2 months, which I was like, oh, this is awesome. And then the injuries I had were sports injuries. And then actually my first away rotation was a sports rotation. This is all just luck of the draw, but it's been sports, 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 sports. And so coming into residency, try to still keep an open mind and go into each rotation like I wanted to do that, right? I think that's the best way to go into it. No matter whatever field you're into. If you're in general surgery, if you're in whatever internal medicine, each rotation that you do, if you come in with the mindset like, oh, I want to do this, you get a little bit more out of the rotation and you learn more, and then people want to be around you more. If they sense that you don't want to be there, then people don't want you around, then you get a worse experience. So just going around and being exposed to sports early, and then I like the procedures, and then another part of it were the mentors. My mentor that I ended up getting paired with towards the end of residency ended up being one of the sports doctors that I worked with a lot, and we kind of just both just connected. We were both hard workers and liked the surgeries. The surgeries to me were fun, and for orthopedics, it's a different skill set because a lot of it is with arthroscopic surgery. So you develop your open surgery skills or your percutaneous surgery skills through trauma and things like that. But then when you have to do surgeries using an arthroscope and long instruments that you can't see, but you're looking at a camera, it's a different skill set that you learn. And I like to play video games when I was a kid, which I'm sure probably played a part of it. So all these different things are what brought me towards sports. It's a great field. There's a breadth of cases. There's a lot of people that you can take care of. The patient population typically wants to get better, right? Most people want to get back to doing whatever they were doing before, whether it was, your 18-year-old football player or your 60-year-old lady that likes to play tennis. They mostly all the time like to get back to what they're doing and they want to be able to do those things. And so those are some of the reasons that brought me towards sports medicine.
nice, man. So I want to switch gears a little bit.
Let's do it.
This podcast is about highlighting the life or the story of a Black surgeon. I wanted to ask you a little bit about some of the things that you might have faced during this journey since it's a child. Are there any challenges that you have faced because of the color of your skin as you are embarking on this journey becoming a surgeon?
Yeah, I remember I was an intern on my general surgery rotation. It was early in the morning, like 6 a.m., and you go in and you round on all the different patients on the service. And I think we just switched services. So it was my first day on that rotation in general surgery, going around and, on the people and making sure, seeing how they're doing in the morning. And if they need surgery, you kind of make sure that they're all prepped up for surgery, that they have their consents or whatever it is. And I remember I walk into this one patient's room. He's Caucasian male. And before I could say anything, he was like, "Are you my doctor?" And I was like, "Yeah, yeah, I'll be your doctor for the day." He was like, "I don't want you. I don't want a black doctor. I want a white doctor." This is before I said anything. I was like, it caught me a little off guard at first, right? And he was like, "No, I want a white doctor." And, I tend to have a pretty chill personality. So I was just like, okay, whatever. We'll get you if you don't want a black doctor, it's completely fine. I'll get somebody else for you. It's no problem. And that, was an interesting experience to start off as an intern in general surgery, just because you're always reminded a little bit that you have the color of your skin, right? In many different places and many different times, right? Another time is I think I was a chief resident actually. I was a chief resident going in the hall to go around on the patient after leaving surgery. So I still have like the scrubs on. I still have a scrub cap on my head, and I'm walking around the corner to go and walk to the patient's room. And one of the nurses that is there is a guy that I hadn't seen before. But I walk around the corner, and he's like, "Oh, hey man, I'm glad you're here. Yeah, the trash can's over there. You can go take it out." I swear, first thing he said to me. And I was like, it's all about how you react, right? In the way that you carry yourself. And me, I was just like, oh no, I'm actually the doctor. I'm here to see the patient. And he's, oh no, oh, so sorry, very apologetic. And so, you can react of one of two ways. You can get mad and curse him out and, and make a big scene out of it. Or you can just carry yourself with composure, stay chill and say, oh no, I'm actually the doctor. But whenever the person that gets here that's supposed to do it will make sure that it gets done. That way you're still being nice, but you're also communicating the fact that, yeah, I'm confident and this is what I do. And no, actually there are doctors that look like me. So I think when it comes down to it, wherever you go, you'll probably face something, right? I think there are special places like Morehouse School of Medicine or Howard, one of these historically, ethnically diverse. I think that's the right way to put it. Ethnically diverse institutions where you may get not a false sense of security, but you'll forget like this isn't how it is in the real world. Like you go out in most places and you're most likely the only person of color, right? And so you
Yeah.
just gotta fall back on your training and remember that you are where you're supposed to be. And I'll tell you a story that I haven't told before. Dr. Clarence Shields. I remember I was following him. This was during the nth dimensions, and we had some traveling fellows, European traveling fellows, right? And so what they did is they would go to different places and the doctors there would host them and do different activities with them. So for a little while, they would come to the OR and see different surgeries. And then afterwards, you may go to dinner. And then afterwards, you may go to golf or go to the beach or something like that. I think we went on like a really nice hike and then ended up going to this like exclusive club, like one of those golf clubs or one of those country clubs, something like that. And I remember at the end of the day, because I'm not used to this kind of stuff. I didn't grow up like that, right? I'm not used to any of this type of things. And I remember asking Dr. Shields, I think we're in the locker room finishing up, and I was like, "Hey, do you ever feel out of place? Like, like this isn't necessarily where like where you belong, or you ever just feel out of place?" And I remember he told me, he was like, "No, you belong." He's like, "Always remember that wherever you are, you work for it, you belong there," and that always just stuck with me. So, whenever whoever's listening to this, whenever you face whatever situation that you may face in the future, because we all will, just remember that you belong there and remember to stand on your training.
Oh, that's powerful, man. You
Hey,
belong.
there it is. You
I
belong.
love it. So, another thing I wanted to ask you is that, as us as a physician, we do face, those situations where some people think you're not the doctor, whatever, it's fine. But at the same time, there's a different aspect of things where our patients, right? Sometimes people of color would come to the hospital. At times, I feel like, I've witnessed this, is like people are not being treated right just because of how they look like. And so, patient education is
The
very
patience.
important. The patients, exactly.
Yep. Yep.
And so, and that's why I think it's so important that we have physician from different backgrounds, Black, white, Hispanic, Asians, to represent the population that they're treating. But as you know, there's about 2.7% of orthopedic surgeons are Black. So it's not that many. Probably the number is getting better. But what can we do to increase diversity in this field, especially surgical fields? I just feel like it's very, very limited.
Man, things that you're doing right now, this podcast is a way, right? Somebody will listen to this and listen, not necessarily maybe this episode, but listen to episodes with you and other people and get inspired. I think it's all about lifting as you climb, right? As soon as you make it up, you find a way to go and help other people, right? So if this is in a way where you go to an elementary school and you talk to the kids and just tell them what your job is like, or if it's a way of volunteering, it's just being seen in the community. Some people, it's a little bit easier when they see somebody that looks like them that's doing something, right? It makes it a little bit easier for them to want to try to be or do those things. So to me, it's all about, once you made it somewhere, it's about bringing the other person up, right? It's no longer really about you, but it's about how many other people can you help get to that point. And I think that's where we all should try to continue to pass it on, right? Like Dr. Bonnie Simpson Mason, she's helped at this point hundreds of physicians of people of color make it into very difficult to be residencies, very difficult to get in or very difficult to match into residencies. And so she's a huge person that has helped bring a lot of other people that look like her or similar to her into positions where they're able to help other people, right? So for me, I'll likely be giving back to interventions at some point and hopefully having a student with me. So these are all these different things. I'm actually trying to work on getting Morehouse students to come rotate with me right now.
Nice,
So
nice.
this it's all about just giving it back. And I wanted to quickly touch base on one of the things that you talked about. So being a black surgeon, right? There are some things that you'll face, like some of the stories I told you about, which aren't necessarily that great, but then there'll also be some good things, right? Like you'll have grandmas that'll come in and be happy to see you. I remember I had a lady that drove an hour and a half to come see me in clinic, and she was just like, I just wanted to support you, you know?
Yeah,
So there are good things about it too. It's not always all bad.
yeah. That's a really good point. I think some of the best moments is when you walk in a room and somebody is just like so happy to see you, and they just feel like they're
Yeah.
super safe, and they just feel like, man, I didn't, it's like, man, you're doing amazing. I'm like, whatever you tell me,
That's
I'm
it.
gonna be. It's just like,
Yeah. They dap you up like, "Yo, what's
yeah,
up?" Like,
yeah,
there it is.
yeah. That's like those are the best moments, to be
Yeah.
honest. And there are those moments when I walk in and especially I grade you, and it's like an older black lady who would just be like, "You look like my grandson," and I would just
That's
be
it.
like,
Yeah, man. You know how many grandsons and nephews I look like? Oh yeah, it'll definitely happen.
yeah, yeah,
Definitely. So it's a good thing.
and that's what it's all about. So for students out there who are thinking about, maybe pre-med or medical school surgery or orthopedic surgery, what advice would you give them early on in their journey for this kind of career?
Well, really early on, if you can shadow somebody, because that's great. Because the more you know, like, especially if you know somebody, and it doesn't have to. You don't have to know exactly what you want to go into, but the more exposure you get to medical field, the better. All right. So sometimes people may know people. You never know who knows who. So getting some early exposure is good, but honestly, the grades, studying, you got to do good on the MCAT, right? There's some things that are real uphill battles if you don't do that well on them, right? One is the MCAT as a pre-med student. Like if you score high on that, way more doors open than if you score lower, then you have a lot more hurdles to get over in order to make it into med school. Not saying that it can't be done, because it can be done. I've seen it done many times, but it's a lot easier if you have your good grades and if you score good on the test. Because it's so competitive to get in these days that a lot of schools, they have numbers to cut people off from interviews so they can decrease, or they can get a actual, like, normal number of interviews, right? So if you have 10,000 people applying to your program, how do you decide what 100 people you're going to take? There has
Mm,
to be something where you're like, okay, we need to take this down. So a lot of programs, they cut off from numbers. So honestly, things to start off are going to be studying, getting good grades, getting good MCAT, taking that really serious, and getting involved in other things as well, like getting involved in some extracurriculars, some things that help build leadership. They help build how you work well with others. I think all those things play a part, right? Me looking at it at this point, I don't know necessarily for medical school, but I know we definitely did it for residency, is I would take the person that scored maybe a little bit lower on their exam, but they had all these other things, like they were a captain of this, or they were in this club, and they did this things, like they are a more well-rounded person that works well with others, that knows how to take charge, that's trustworthy. All these different things all play a part in making an overall well-rounded person, and as well as a well-rounded applicant.
nice. Speaking of succeeding in medical school, I know somebody wrote a book.
Tis true. Tis true. It is true.
Are we looking forward to another, sequel of the book, or is that?
You know, I was thinking about it because some of the resources that I have are a little outdated now, right? Like Sketchy
Mhm.
Micro, now there's like Sketchy Farm, Sketchy Path, and all these
Yeah,
different things of that sort. So
yeah,
the underlying principles are the same, right, for doing well in med school, but I think some of the resources have now changed. So I mean, there may be a sequel in the future, an updated version with the most recent things and maybe some little edits here and there. So possibly, you can never say never. Never
hey,
say never.
hey, we're looking forward to it. Almost I want to wrap it up, but I wanted to touch base on your current life right now. You just started practicing. I'm sure just like from medical school or from from college to medical school, from medical school to residency, those first few days are always, there's it's like still again used to things. You don't know what you're doing. I'm sure you know what you're doing, but I'm just trying to get a feel of that experience because I'm close to that time, So
Yeah,
how is that feeling like, and how did you end up choosing? Because you're in a private practice right now, right?
yeah, yep,
And
yep.
how did you end up choosing private versus academia?
So the same recurring theme, right? So some of the people that I knew during med school that worked with Resurgens, I kind of, he was one actually my mentors through med school, Dr. Gary Stewart. He's actually the first person I ever had on my orthopedic surgery podcast. But anyways, long story short, this is actually a practice that I actually had my knee surgeries done with when I was way younger. So it's crazy. I'm working for him now, but Resurgence. So that's where I'm at now. It's a private practice group. And one of my mentors, every couple of years, I would tell him like, hey, I'm thinking about doing sports and hey, in 2 years I'll be done. All right. And, in about a year I'll be done. And so he actually let me know about this job position, or it was given, not given to me, but I was made aware that this job position was opening, right? And so I came and I interviewed, and I actually liked the group a lot. It seems like they liked me, and then I actually had surgery through this group when I was younger. And this wasn't the only place that I interviewed at. I interviewed at a couple different places, but to me it was, again, who do I know that's a part of the group that can attest to how they are, can attest to their lifestyle, can attest to the integrity of the people that I'll be working with. And so that's kind of how I chose where I'm at, right now today. And to answer the second part of your question, what is it like being an attending? It's you just realize that everything's on you. It's everything from what kind of supplies do you want in the clinic, to how do you want to run your clinic, to what dose do you want, to when you're doing surgery, what suture do you want to use, how do you want to set this up. It's nice because you're in control of everything, but with every increase in control is also an increase in responsibility. So everything that also goes wrong is your fault too, which is good, right? So you should take full responsibility for the things that go right and also the things that go wrong. It's a learning curve in the fact that you learn how to speak to patients, you learn how to talk to them, and not everything is all clear and cut like it is in the book, right? A lot of times there's some gray areas, and so you learn how to manage that. And but it's good to, at the same time, like, this is what you've been training for, your whole life. This is what you went through X amount of years of undergrad, X amount of years of med school, X amount of years of residency, and the fellowship to finally be able to go out on your own and do it. So
Yeah,
part of it is like, okay, you also fall back on your training again, and know that you're ready, and know that you deserve to be there. So
you
it's
belong.
just a little bit more, it's more responsibility, and more control. And at times it can be nerve wracking. But if anything ever comes in and you're not necessarily sure what to do, you have colleagues, you have other people, you have your mentors from your residency that you can talk to. So always remember, like, you're not always in this 100% alone.
Nice. All right, man. I think that wraps it up. I appreciate you. Thank you
There it
for
is.
taking the time. It was an amazing talk. Nice catching up with you.
Hey, likewise.
Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also, by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys, and we'll see you on the next podcast.